I am now with Dr. Karen Guba and Dr. Michael Harris of Midwest Integrative Dental Medicine, our title sponsor for Wellbeing Fest. So excited to have you here. You're going to talk to us about Healthy Mouth, Healthy You. A bit about the doctors of Midwest Integrative Dental Medicine. They combine the most advanced alternative wellness treatments and holistic practices with conventional dental procedures to ensure their care is both beneficial to your overall health and appropriate for your unique dental and physical makeup. So thank you much, and I'm going to hand it over to you.
Thank you, Jen, and thanks for having us. I'm Dr. Michael Harris. This is Dr. Guba. We are thrilled to be here with you again this year. It's our second year doing Wellbeing Fest and had such a fun time last year. Just want to give you a few items to talk about what it is that we do and why. The title of our talk is Healthy Mouth, Healthy You, because it all works together. So just a little bit about us. We have a practice on the east side of Indianapolis, just outside of Cumberland. That's Dr. Guba on the right. It's Dr. Harris on the left. There we are. That's by the tree, out by the pond. So have a nice spot out there, a little bit of land, but we have a pretty nice operation. Take care of people local and also not local. So that's kind of what we do. Dr. Guba is going to give us a little bit generally about what we do, then we'll deep dive into just a tad bit of our fun stuff here.
So basically you have to have good digestion and nutrition if you're going to be healthy. And your digestion begins in your mouth. You know that you have to be able to digest your food. A lot of people know that you have to have enzymes, you have to have the proper supplementation, you have to be able to use all these in your body. And if you don't have a way to chew those foods and you don't have good saliva, then all this has gone to waste. So we work to get you the proper chewing techniques and healthy teeth so that you can use that to get that digestion going, because if you don't start it in your mouth, you can't absorb it in the rest of your body. Starting with your teeth to chew with, then you use your teeth as sensory organs because each of those teeth have nerves in them. Teeth also are on meridians because teeth work with energy flow. There are meridians all through your body. Your body itself has electricity in it, and it all starts from the top to the bottom, and the teeth are a part of that.
Here is a chart, just kind of a little illustration, kind of detailing which tooth is connected to what meridian, and along those meridians, which organs are related to each tooth. It's not uncommon for us to see, a number 3, an upper right tooth, associated with a stomach problem, for example. Don't worry about memorizing this chart. We can send that to you and have it available for you. Just
you
in
can
case
download that.
Yeah, just in case it's something that you're interested in.
So sometimes you can have a tooth that's infected that can be related to an organ, or an organ that needs extra nutrition or extra work that can be affecting a bad tooth. So it can go either way.
All right, so one of the things you have to know first is, well, if we know things look good, then we can know why things don't look good. Physiology being a healthy situation, pathology being a not so healthy situation. So to a lot of people, this situation on the right doesn't look awful, but if you look really closely, there is a little bit of bleeding associated with those gums. And you say, okay, well, there's a little bit of pink in the sink when I brush my teeth, not a big deal. Well, if you don't take care of it, then you may end up with a little bit worse situation, which is, that's not good. When you have that, you're going to have a bad time. So what we aim to do is make it so you never get here. That's a combination of decay and some periodontal disease, some gum.
But in order to get to that, we have to be proactive. And that's what is so important to us, is to help you to understand that if you do have a little pink in the sink, as he said, some people tell us, well, my gums always bleed when I floss, or I've had that since I was a kid. But we need to help you understand that that's not normal, and we can help you get to that point. Because if you had bleeding somewhere else in your body every day, you would understand that's not normal.
Very true. So, what are our threats to oral and general health that we normally treat here at our office? General decay, that's a cavity. That's pretty self-explanatory. If you look back maybe one picture, that's periodontal inflammation. That's that one, bleeding gums. Mercury and metals, that's a big one that we do. And root canal teeth, we'll get into that a little bit later. Okay, so this is a horse. You ever heard the situation, long in the tooth, or don't look to get horse in the mouth? Well, that's because horses commonly have periodontal, because horses don't floss. But they, as a result, they have equine periodontal disease, and that's why a horse is long in the tooth, because they didn't come to us and get their preventative care. That's why you can look them in the mouth. Okay. So anyway, this gum disease that we see sometimes is a source of chronic inflammation, which we also know is related to diabetes, heart disease, endocrine disruption, strokes, and for those of us who want kids or have kids, premature birth and low birth weight. It's not healthy, and it's something that, you know, by taking care of things preventatively on the front end, we hope to have you be healthy.
And the thing about taking care of things on the front end preventatively is with gum disease, about 80% of the population has this and don't even know that they have it because it's painless and most people think it's normal that their teeth bleed a little bit. So that's why it's really important to get this checked.
Very true. Okay, big question for us always. Well, I have a few silver fillings, but they're okay, right? I read something on the news about mercury and metal. It's okay, right? Well, despite what the ADA may say, no, it's not. Short answer. Here's an example of a tooth with a mercury filling in it. You can see that it's cracked because metal obviously contracts and expands with temperature change. So not only structurally is it a problem, but also chemically and physically, emotionally.
So if this type of a filling is in your mouth, anytime you drink a hot liquid or eat hot foods, the vapors from that mercury are released and get absorbed right into your system, which is right next to your brain. Up until this past week, the FDA said mercury was fine. Last week they came out and said it's not fine for children under 6, for people that had MS, for pregnant women. Was there one more? Basically, it's over 50% of the population.
Everybody else, it's fine.
Everybody else, you're okay.
It's good.
OSHA has said that you shouldn't use it, but it's okay. No, the ADA said it's okay if it's in your mouth, but it's not okay if we take it out of your mouth and it lands on your lip. Then we have to store it in a sealed container. So, using that information, you can make your own decisions.
Mm-hmm. Okay, so no, it's not. Spoiler alert. Mercury we know is highly neurotoxic. These fillings are over 50% mercury, and the vapor does seep out forever as long as you have them. And the residues deposit themselves into your tissue, at which point they're not only neurotoxic, but again, endocrine disruption, death of neurons. What else?
Heavy metals can so many things into the
That's true. That's a talk for another day. But what we know is the most important thing to do is get rid of these metals from your body and then find a way to detoxify yourself. So when we do it, we have to be smart, and that is a small play on words. SMART, and this is something else we can send to you, stands for the Safe Mercury Amalgam Removal Technique. It's the
certification process.
It is, yeah. It's a few hours of reading. Yes. So we have extra clothes that we wear. We have a huge vacuum. We have, if you look at really closely at the picture here, we have all sorts of protection for the patient, and we do all this to make sure that the mercury that we remove from you does not enter your bloodstream and your
Or our
system.
staffs.
Yes, that's true also. Very cool. So that's Molly. This is one of our longest term team members there. She's fantastic. And that guy, who is that? I don't know. Okay. So we talked a little bit about mercury and how dangerous that it is. I want to let you know that that's not the only metal that your body doesn't like. Example here, we have a crown that looks like it's all porcelain, but a lot of times in the old days, back in my day, in the old days, you would have a metal understructure underneath the crown. And what that does is it tends to cause really, really severe chronic inflammation underneath your gums. And that's another thing that your body doesn't like and we try to avoid. So that's one example. Yet another is before the days of ceramic implants, we used titanium fixtures when you lost a tooth and had to get a new one. And there's an example. Again, you see your tissue running away from the metal because your body's not made out of metal, and so we don't use it. So, okay, that's metals. Okay, Dr. Guba, do you want to talk a little bit about root canals and why not?
So in this slide, you can see this dark area here is where you've got a cavity. The center part of the tooth is where the nerve is, and when this cavity gets too close, this bacteria starts to get to the center of the tooth where the nerve is, and it infects that. So we can't have that. So when this part gets infected, you start to get the infection that goes clear underneath here, and the infection gets into the bone. The only way to fix that is you've got options. One option is to do a root canal, takes the nerve out of the tooth, then we fill the tooth with filling material inside, put a crown on the top. A lot of times that doesn't work because it's basically impossible to clean the inside of the tooth and get it sterile. Sometimes it's okay if you're perfectly healthy and your body's not exposed to any toxins and you can wall off that infection. Other times you start to develop this infection in the bone, and if that's the case, the tooth has to be removed, and then we treat that by cleaning the infection out of the bone. In our office we treat it with ozone. Sometimes we put ozone right into the bone, sometimes we use ozone injections, and then we're able to heal this and place a ceramic implant in the spot.
Mm-hmm.
Okay.
Right. So just to explain that joke here. Endo is short for endodontics. It's a recognized specialty. There are specialists that only do root canals. Those guys are called endodontists. Outdo, I made that up. That is a word that means the tooth has to come out. So you can either do endo or you can do outdo.
Most of the time it's out.
It's probably 99.5%. So that's why. Okay. So as Dr. Guba mentioned, problem with endo teeth, we lack a foolproof way to get them completely clean. You leave, 50 CFUs, 50 individual bacteria. Over time, those will grow and proliferate, and they'll cause you to have a bad time with that tooth. So again, in a less than fully healthy patient, bacterial growth will spread and cause you to have chronic inflammation in your jawbone, which is not good. And worst of all, we're talking about an energy disruption. If you remember the chart with the tooth meridians and the organs, everything's connected. You have a problem in a tooth, you eventually have a problem in the organ that's connected to that tooth. So these are things we try to avoid. Okay, here is we got a fun kind of 3D super fun X-ray machine in addition to our normal X-rays. This here is what we call a cone beam CT. It's a 3D scan that we can look at your whole face in real time in all three planes. This is an example of a patient I saw not long ago. 6 root canal teeth, and you can see the inflammation associated with those guys, areas of dead bone. I can send this on the slide as well if you want to see it. But this is a person that also on the same side of their face, they had the root canal teeth. She came to us because she had a pretty aggressive tumor on that side because of the energy disruption, or at least related to it.
Another thing she has is, if you notice this big area, this bump, this is the sinus floor, and that should be smooth and it should be black. This is clear airspace in the sinus. This is a big either cyst or mucus that's stuck up in the sinus related to these root canal teeth.
Mm-hmm. Yeah, so this is an example of what we see when we look at these teeth.
And we see this all the time.
Mm-hmm. Yeah, so really, really happy to have that technology to be able to help visualize these things in real time. Again, here is an area of dead bone related to a root canal tooth, and these are cross sections. You may not recognize those as much, but this is an example of the imaging that we use to figure out what is the best way to either fix.
These are things that we can't typically see on traditional X-rays, but we can see them very clearly on the 3D scans.
Mm-hmm. Yeah, so it's a fun time. Okay, so what do we do instead? We use a ceramic alternative that is what we call immunologically neutral. It's not going to cause the inflammation that we normally get with titanium fixtures that we used to use. They're metal free. Your soft tissues, your gums are going to really, really love these, and they're going to stick to them like they would a normal tooth. And again, most importantly, your energy flow is restored here. You're activating those meridians, and you're able to maintain your musculature, your jawbone health, all those sorts of things. So it's a natural solution that is pretty cool, if you ask me. And Dr. Guba, I think, totally agrees. So. Dr. Guba said I didn't have to include this slide, but I thought I did a good job this time. I tried really hard at that one. So this is about what it looks like. This is the ceramic implant in the place of number 19, where you had an infected tooth, and so we traded it out for a better one. So it's going to be functional forever.
Good job.
Thank you. That's all I wanted. So here's it. Dr. Guba, tell me about this one.
This shows in the top picture, it shows after a tooth was removed, so there's a space. And then after that has healed, we're able to place the ceramic implant. And then in the very bottom, that shows how the crown goes right on top of there, and you can't even tell that there's a missing tooth.
Mm-hmm. See how the tissue, I don't know if you missed that, the tissue.
The gums just adhere right to that ceramic. So this is so much nicer than the old days when we had to use the metal, and you can see that black line right around the edge. So in this case, you can see how the gums is just right up against that crown.
Mm-hmm. He likes it.
Yeah, so we like that so much better.
Okay, so in summary, we know now that your oral health is not separate and distinct from your whole body health. It's very much connected, and sometimes even the cause of it or cause of lack of it. So it's crucial that we take care of you even before things become a problem, so that your whole body and your whole deal can be healthy. Silent infection and inflammation can keep you sick if not addressed. A lot of times it doesn't hurt, when you do have a problem. So it's important to see us or anybody on a regular basis. And most importantly, they're not only solutions, but they're natural solutions. They're not toxic and are not going to keep you from getting better by having these materials as part of your body. So, okay, if you have questions, comments, we are on Instagram. If you search for Midwest Integrative Dental, we're there. We're on Facebook as well. Dr. Guba might tell us a little bit about her mask chain. Can you mention that for us?
If anyone's interested in these lovely mask chain, necklaces, jewelry, my daughter is making these. And she has an Etsy store. It's shopjackieb.com.
Mm-hmm.
You can flip them around and wear them as a necklace.
Very classy. Very good. Okay. Well, guys, just big thanks to the Indy Holistic Hub for having us, and Jen, our patients and friends. Don't hesitate to contact us if you need anything. But we're so thrilled to be
happy
here
to be here. Thank you.
for your virtual event.
We are happy to have you here too. Thank you so much. So we learned a lot of great information on our mouth. It's integral to our whole body, which is important information to know. And you can follow Midwest Integrative Dental Medicine at www.midm.io. Also on our market partner page, along with all our partners, you can find more information, special offers, event offers as well. Thank you so much. Appreciate you.